Hi, everyone. Thanks for joining us for another session of Hood Med Chats. Tonight, we're going to be talking about the impact of the pandemic in Latinx communities, and we have two very special guests. Fellow alum, MIT alum, Dr. Raymond Morales, a cardiac fellow, media entrepreneur of the show, and also Latinx activist. And we have Hazel Ozuna Vázquez, who is a PhD candidate in microbiology and immunology at the University of Louisville. So thank you for joining us tonight, you guys.
Thank you for having us.
Thank you, privilege.
Yeah.
As always, we have Hood Medicine's policy chair, Jonathan White, joining us as well. But we are super excited tonight to have our resident hacker, Dolio Durant, join us on the Hood Med panel. So thank you, gentlemen, for joining us.
Absolutely, always.
So one of the things that we've been doing with Hood Medicine is just trying to make sure that we can put forth like trusted scientists and doctors to try to explain the science around the virus and the vaccines, answer people's questions, reinforce social distancing recommendations from the CDC, and ultimately, get our communities mobilized to go get vaccinated so that we can all be protected. I think, as we all know, it's the Black and Latinx communities and Indigenous communities, for that matter, who have been hardest hit by the pandemic. Our infection rates and hospitalization rates and death rates for Black people is like 3 times the national average. For Latinx people, it's like approaching 4 times at this point. There's a lot of cities like Chicago, New York. I mean, obviously various cities in California, Texas, Utah, Oregon, where the highest, population incidence is within Latinx communities. And there's lots of reasons for that, and I'm hoping that we'll get into tonight. But I guess I'll start with you, Ray, because we were hoping that you would also bring a little bit of perspective on what it's been like for you in the clinic as a physician. Like, what has the age of COVID been like for you in general?
So by way of just review of who I am, cardiac critical care fellow, and I went through the pathway of, being a pediatrician and subsequently pediatric cardiology. And so a lot of the patients that I dealt with were pretty much the pediatric side of things. With that said, we did definitely have some adult patients that we had to care for, given the sort of age range that the pediatric ICUs care for. Now, one thing that people don't realize is that even though COVID is predominantly an adult manifestation and influencing probably 1 out of 9 hospitalizations right now across the country is that of a COVID patient, that has severely impacted the pediatric care. When it first started off, a lot of our resources were diverted to make sure that we could care for the adult patients. For example, we weren't doing a lot of elective day surgeries for pediatric patients. Maybe you had a heart defect that could wait another month or 2 before it was repaired. Maybe you had a particular, tonsillectomy or adenectomy that needed to be done, and maybe that could be deferred for a few months. And so a lot of those procedures would be getting delayed because they needed the ventilators. They needed the medications associated with a patient being intubated. They needed the anesthesiologist to be available. They needed the surgeons to be available in case they needed to care for the adult care physicians. So a lot of pediatric care was actually being shifted and deferred, and still to some extent is, depending on what area you're at. Also, a lot of space utilization. A lot of hospitals, some hospitals are not just purely pediatric hospitals. Some hospitals are a mixed bag, right, where they have pediatric units and adult units. And so what would happen is, because again, 1 out of 9 patients hospitalized is a COVID patient, all right, and they're usually needing some oxygen therapy, and these are COVID units, so you don't want them spreading to other places. They're trying to isolate those patients. They ended up taking spaces, wards, if you will, or units that were dedicated to pediatrics, whether the NICUs or neonatal ICUs, intensive care units, or just general pediatric units, and allocated towards adults because there were just so many. One hospital I worked at ended up having multiple floors opened up, and spaces that weren't even dedicated to, kind of not even finished, but quickly remodeled and finished. And then when they went out of that, they came into the pediatric space and used the pediatric ICU. They even took, as a result, moved the pediatric ICU over to the NICU. So they ended up taking a third of the NICU out and giving that to the pediatric ICU. And what that has also done is it shifted care and resources, because then that also impacted the clinic, right? Because then the clinic's referral system was all taken aback, because, if they need to admit patients, and parents were also scared to bring their kids in for visits, right? So we have a lot of our kids now who are potentially delayed in vaccination. This is a very common thread across the country, delayed in vaccinations going on because families are scared of going to clinic. They're just scared of being in the waiting room with people, right? Not everyone is honoring that system and trust, and you see it across the country, not wearing the mask, not separating by 6 feet, and you go and you ask people to wear the mask. Oh, you're taking away my rights, and they're kind of putting up these walls and these fronts in that regard, and not adhering to these private businesses, potentially even community spaces that are saying, hey, we're looking out for the best care and best health of our communities, and need you to just follow these simple things for this short time that we're together, so that people with immunocompromised or really vulnerable populations are not at risk. So those are just some of the ways that they've impacted us.
So in terms of the ways that, like, sort of what you're hearing from people, like from patients, we've heard a lot of, stories about how people are still sort of even in denial about the virus, and up until their dying breath, will contend that they don't have it because it doesn't exist. But in terms of sort of managing patients, what is your sense of, like, how people are they taking it seriously, or are they still, like, even after treatment, are they still, like, being flippant? And
I think that unfortunately there's a segment of the population that has branded this a political issue rather than a health issue. And then for that reason, they're not following very simple, basic sort of recommendations as a mechanism to make it as a, I don't know, they're being rebelling or revolting, I guess is the way they're being insurrectionists, I guess is the way to describe their conduct. And I would say that there's also the thread that, most people who get COVID are relatively going to be asymptomatic. They're going to have mild symptoms. The overwhelming majority, probably over 90% of the people who get the diagnosis are going to clinically manifest with little to no symptoms. And that can be misleading, because it's not always, something that you can see physically that people manifest with. There's a lot of changes with, the lung tissue can, remodel or have changes that we don't necessarily see, that can be long lasting, that we don't really have enough information about. And it's not only the respiratory system that's involved, it's also the cardiac system. It's also the blood coagulation system that's impacted. So people having aneurysms as a result of this, having blood clots being thrown, or abnormal clotting that happens as a manifestation. And because this illness, it's still in its infancy, there's still a lot of misinformation that still people are clinging to from early on, that they're using as a way to sort of fight things. It's not uncommon in a conversation or exchange, whether it's in person or online, for people to say things, oh, they're exaggerating things, most people, I'm likely not even going to have any symptoms. 99.99% of the people are going to be fine, just making a big deal out of it. If I could tell, it's like when I tell people, if I could tell you who was going to get cancer, if I could tell you who was going to get sick, I would only ascribe the medications to those people, like vaccines, etc. But I can't. We don't have that predictability yet, right? So as a result, we need to use public health policy as a way to help prevent the infection, so we don't even get to that point. Because the people who do get ill, they get ill quickly. Mm-hmm. And it's been astounding to me. I had one kid, I walked into the ICU, I tell the story over and over again. At first I saw her, and she was a patient who had a long time ago, as a child, had a cardiac issue, and that issue was long resolved, and she was doing well. And she gets admitted to the ICU because she was needing a little bit of oxygen, but she looked fine. She was having a conversation with me. She's like, why is this kid in the ICU? It's like, oh, well, she had a COVID exposure. We need to make sure she's in isolation, blah, blah, blah. I'm like, fine, no big deal. We'll take care of her, make sure she's got the best care possible. I come in the next day, this girl's intubated, got a breathing tube down her throat. And I'm like, what just happened? And it's been such a common thread in terms of the story. Like the illness turns so quickly that it is really difficult to map out the trajectory of the illness. Like you really have to be prepared that when a person starts having respiratory symptoms, starting manifesting that clinically, that they could escalate exponentially. And that's something that it's really hard to convey to people about, that like you can get really sick really quickly, you know? And that is the one thing that I think is different from other illnesses that people are underestimating.
So I wanted to kind of take a step back and talk, as we do in most of our chats, about
Thanks for joining
COVID
us
and
for
about COVID, what it is, how it looks, how it manifests itself, some of the basic information that people should understand about the disease. And I think you do a pretty good breakdown of that, Dr. Hudson.
Sure, yeah, in general, so we know that COVID-19 is a coronavirus, right? That's the type of virus that it is. Viruses in general are parasitic, so they need hosts, let's say, to survive, for one. They're not like bacteria that can survive for millions of years on their own. And that's because all they are is really just a little protein bubble with either a piece of DNA or a piece of RNA inside. And in this case, in the coronavirus, they have little spikes on the outside that help it sneak into your cells. But these spikes, the spike proteins that we're always hearing about, are also its calling card, right? So that's how your immune system recognizes what it is, produces antibodies against it, and mounts a defense against it when it enters your body. Excuse me. And so I guess in particular for this virus, one of the things that we try to emphasize of why it's so important to really maintain those social distancing guidelines, wear your masks at all times, and not mixed households is because, in particular, it lingers in the air a really long time, right? And the droplets are really tiny. And so that just makes it a lot easier for people who are like sort of indoors to spread it very easily, which is why we're seeing that so much of the spread is happening in people's homes, right? Because we've taken our masks off, let down all the barriers that we're used to putting up in the grocery store and letting it right in. And essentially what happens is that once your cells become infected, the virus basically takes over your cell machinery and it hijacks your cell so that that cell stops working for your body and stops making proteins and sending signals related to your genetic code and starts working for the virus and making viral proteins and making more viral particles that you then sneeze on everybody who has no mask on or their mask pulled down right here or is at your house and has no business being there. And so once that happens, for now, what we're seeing is that because of where the spike proteins sort of, because of how they find the cells that they want to get into, the ACE2 receptors that we have on a lot of our organ systems all over the body, the brain, the heart, the lungs, the kidneys, the pancreas, because it has that easy point of entry of your nose and your mouth, and it sets up shop there. But we're seeing people who have like these multi-organ system, long-term, sometimes permanent side effects, and that has a lot to do with sort of the way that the virus is able to begin to start moving on to other cells that have those receptors, once it takes a hold and starts replicating. And I think what is important about the vaccines in terms of the way they're designed is that instead of sort of you getting infected and then your body naturally trying to figure out what is COVID, like what do I do now? You're essentially giving your cells a cheat code, right? That tells your cells to make the little protein, the little spike protein or a little piece of it, and then throw a huge party on top of your cell and invite everybody to come, right? Like the memory cells, all the killers, the assassins, everybody comes to the party. They see what COVID's all about. They take it back to the library and your lymph nodes so that the next time you encounter COVID, the next time it gets into your body has what it needs to just fight it off effectively, right? And so that's kind of sort of the general, like the basics about the virus and the vaccine. I wondered, Hazel, kind of like from your perspective, like how important, is it that people start to understand the science behind the vaccine so that they can understand the point of the recommendations that we're all making?
Yeah, so the vaccine, basically what it does in general, before I get into detail, is that it creates that immunity, but without you getting COVID. So basically, like you mentioned, this spike protein on the surface of the virus. The vaccines that are available from Pfizer and Moderna, which are the ones that are being distributed right now, they are mRNA vaccines. So mRNA vaccines compared to the vaccines that has been used before is instead of a dead organism or a part of the organism, it's just basically like a set of instructions for your cells. So this gets into your system. These instructions are received by the cells. They make this spike protein, which they will then present on their surface to other cells, to like the other immune cells, especially B cells. Now, that takes weeks, and that's why in the case of these vaccines, you require 2 shots, because the first shot is not enough, and then the second one, it makes it make a stronger response, so then you can produce memory cells and produce antibodies, because those are the ones that when you become exposed to the virus will be like, oh, this thing has a spike protein on the surface. We have seen this before, and we have the antibodies already. So the response is gonna be quicker, and it will neutralize the virus before it starts like making havoc in your immune system.
You made an interesting point about the time in which it takes for your body to build up the immunity, right? Because we recently, or in the last few days, we've seen Congress people who have taken either one or both doses of the vaccine who have been diagnosed with COVID recently, and people are kind of confused,
Yeah.
Why are these people getting COVID if they've taken the vaccine? And your response is the answer to that, because it takes time, even with both doses, for you to get to the high level of immunity that was seen in these Moderna and Pfizer studies. Can you talk more about that?
Yeah. So about like the immunity that it will produce at the end. So far, they don't really know how long is this immunity. So they do compare that if you have COVID, if you produce antibodies, it's about 90 days or so that you may have immunity to get COVID again. So far, the vaccine is longer than that, but they don't know how much longer, like extended amount of time, because, well, it's been about a year. So they will see that with time. And then the importance of getting it is because we want to create herd immunity, basically that there's enough people in the community, they are protected from getting the disease. So then this is gonna slow down the spread of the virus. And then in turn, it's gonna also protect those that cannot get the vaccine, like children or people that are immunocompromised, or in the case of this vaccine that the main secondary effect that it has been seen is like allergies, anaphylactic shock, but this is to people that had shown allergy to vaccines before. So it's very important to get your vaccine, to create this herd immunity in order to protect those around you, especially, like you said, like your family, for example. And like in Latino communities, it's very common that you have generations, a number of generations living in a house. So just one that gets COVID, everybody else is just gonna basically fall like dominoes. So, yeah.
If I could also add that right now it's estimated that after the first vaccine, you only have somewhere between 50 and 60% immunity, whereas after the second vaccine, about 7 to 10 days after that is when you get about 95%. So even though you get the first vaccination, you're still only about half at 50-50 sort of protected, you could, so to speak. And then, that's only a few days out from that. And then second vaccine, which depending on which one it is, whether it's the Moderna, which is about 28 days is the second shot, or the Pfizer one, which is 21 days after that, then 10 days after that point, right? So you're looking at a month after your first shot, at least for the Pfizer one, and about 5 weeks after the Moderna shot, that you'll have the 95% efficacy in terms of immunity. So in that window, of course, you might be a little less vulnerable, but you're still vulnerable, albeit even when you get to the end, you may not be 100%, to be clear about that. And if I could just clarify also about the herd immunity, we need about 70% of the population to get that point. And given our current estimates, whether it's 330 or whatever number you want to use, that would be somewhere around 230 million Americans, right? And so for us to get to that 70%, if we're focusing, and realistically, we're probably gonna have to focus on urban centers, because that's where the largest crowding is. That 100 million that the new president is sort of vying for really has to have an emphasis on urban centers and highly crowded spaces and crowded cities and areas, even in poor rural communities where we're concentrated as well. That's really where the maximum impact is going to be, because they need to get 70% in those areas has much more of an impact on our medical system.
And to that point, Dr. Morales, when we talk about 70% necessary to reach herd immunity, what we're really talking about is 70% in the separate pockets across the country, right? Because if we get 70% of America, but only 30% of New York City is vaccinated, that's not achieving the herd immunity that will protect folks in New York City. So we need the pockets of populations across the country and across the world in general to get the vaccination so that those pockets can be safe amongst themselves.
That's 100% right. And we definitely need, for example, it would make no sense for us to immunize 80% of the population and have only 20% of nursing homes, be vaccinated. That would be even more perilous for us as a society because of the ramifications, again, on the human death toll, hospitalizations, all the things that we value in terms of society.
Mm-hmm. Do we value them though? I think that the pandemic has shown us that that's not on our priority list in terms of our species.
I think that we do. I think we just become so numb because, again, I think this has become a political issue. Unfortunately, this has not been a health issue, which it should be. And people have used this as a sword, a knife in a fight that didn't have to exist, unfortunately.
Yeah. Regarding your points about herd immunity, I just wanted to be clear for our listeners that, a lot of people have a sense that we should just not worry about the masks, not worry about the guidelines, and just, strive for natural herd immunity, where we just let whoever get sick and think we're going to build immunity that way. And I just want people to realize that not every virus is practical to achieve herd immunity. There's the chicken pox where, you might get exposed one time and then you're good for life, right? And it's relatively mild disease in most people. But, like you were saying, it's not practical in sense of like being humane, if we are still that, to push for herd immunity, push for national herd immunity with a disease that causes serious illness, and that we don't know if is even achievable. Like if you think about the measles or, you know, every virus is different, and everyone, you're not going to be able to achieve herd immunity naturally. That is by letting everyone just get infected. You jerks. You know, what we need is vaccination. That vaccination is the keystone of herd immunity. Right now, no one's been vaccinated. COVID is new. No one's ever been exposed. We don't have any immune memory towards it as a species. So as you can see with how red the map is, anytime we're in a crowd or a herd together and none of us have been vaccinated yet, then the virus has free reign to spread through everyone in that crowd, especially those of you who won't put your mask on right and stand back when you're talking to people. But once we all start to get vaccinated, then if you're in that same scenario when you're in a little herd or a crowd of people, if 1 or 2 people is infected in that crowd, then the virus isn't going to have that much of a chance to spread to people in the crowd because it's about proximity, you know, and that concept of the vaccinated protecting the unvaccinated extends to everyone who can't get a vaccine right now. That means children, all of our children who don't have a safe vaccine yet, the people who have medical conditions that are contraindicated to take the vaccine. The point of us doing this is that we get vaccinated so that the people who can't be vaccinated are protected. So just wanted to make that clear.
That's right. And, you know, the notion of herd immunity being achieved through allowing us to get infected is sort of a social experiment that was tried by Sweden, I believe it was, and who severely failed in contrast to their neighbors in Finland and Norway, something like a 10-fold difference in terms of infectivity cases and mortality. And they basically sacrificed their seniors to some pseudo semblance of life that they wanted to maintain throughout all this. And mind you, this is in a highly developed country where the ability to work from home was readily accessible. So even with that, almost 10-fold higher rates, they were able to mask that because they were already sort of set up with their internet infrastructure and sort of high income earners to be able to work from home. So that's not something that's really viable. Along with that, the mortality rate we're looking at, out of everyone who gets it, 1 to 3% of the people are probably going to die from COVID. You know, the ones who actually get it and get documented of having it are probably going to die, you know, if they get into the hospital system. And so you're looking at, if we're infecting, you know, 300 million people, you take 1%, you're looking at 3 million people, 3 to even 9 million people who are just willing to sacrifice with that sort of social experiment that they want to conduct, which is not humanistic or realistic in any form or fashion. I'm not willing to sacrifice that. I think most reasonable people would not be.
Yeah, I think that's the problem, is that we don't have a preponderance of reasonable people running things right now.
Yeah. And to that point, Dr. Morales, a lot of people tend to talk about that number, the number of potential deaths from COVID, in the reverse way. They tend to say 99% of people will survive COVID. And that's sort of a horrible way to look at it, right? Because even especially when you're thinking about the pockets of communities that may get this, and communities such as yours or mine that have historical issues with government, with medicine and whatnot, if someone in our community catches COVID, the likelihood of that spreading like wildfire is greatly increased because of the resistance to going to get medical care, the lack of trust of believing in the type of care you're going to receive. Can you talk a little bit about what you've seen in your community as far as folks accepting the science behind COVID?
I think there's a challenge for medical practitioners to sort of relay and get information out to Black and Brown communities, because the quote unquote trusted resources now have really become social media, which are really dominated by, you know, only so many information providers, you know, in terms of having a stranglehold. Yeah, you may get an occasional article from the Griot or the Root or some other source like that, but realistically, the main, you know, news information providers are going to be random websites sometimes, whether it's, CNN, Fox, MSNBC, and, and their derivatives of those major sort of umbrella companies that provide for them. And sometimes, at least in our communities, there's a lack of trust that leads people to not necessarily or say there's a healthy dose of skepticism that comes with anything the government does, whether it's the vaccination program, information provided, which I understand, but sometimes there's a even stronger push to want to hold things off or wait. I think there was an interview conducted, I think it was with Dionne Warwick recently, where she, sort of saying, I'm a healthy Black woman. I've seen so much happen in my life in terms of mistrust in the government and circumstance, situation. I'm going to hold off and wait for a little while.
Yeah.
Not acknowledging that the predominant person phenotypes of people who are dying and suffering from COVID are people who are over 45 years of age and Black and brown, And so being able to reassure people, I think for me, the main thing has been, and people have probably seen this online, I made sure that when I got my shot, I streamed it live to let people know that was something that I want people to feel comfortable with it. I get that people may feel like I'm a guinea pig because they want to wait till there's more data. Like somehow everyone in the world is suddenly a social scientist and has like a PhD in data analysis is gonna I need my chance to go through the data and go through my statistics. I'm independent, I don't want to insult your intelligence, you know what I mean? But just
sometimes you need to though.
Yeah, I mean, it's like.
But the thing is if they were that concerned about the numbers and the analysis, they would see that at this point, 9 million people have been vaccinated, and we've had under 10 deaths out of that 9 million who have already been vaccinated. And the death rate, which you just said about COVID, is far different than that.
Let's be clear. For example, in the clinical trial that was conducted, I believe it was in the Moderna, the Pfizer one, there were 6 deaths. There were 4 in the placebo and 2.
Yes, in the clinical trial, yeah.
4 in the placebo and then 2 in the people that got the vaccine. And you have to understand that in the human population, there's a set number of people who die. Okay, it's not nothing to do with the virus. Just like with the Bell's palsy thing, there's a set number of people that get stuff that happens to them. There's probably people who are going to break their arms and also get the COVID vaccine. That doesn't make a one-to-one connection between the breaking of the arm and the COVID vaccination. We need to separate those things, okay? Because
people are looking for simple answers, right? Simple connections. And what they need to understand is when it comes to science, there's not always an A to B route to something. Sometimes there's a much more circuitous route to, you presenting as yourself and then you getting some sort of medical affliction, right? Just to kind of dive back a little bit to something we were talking about earlier when we were talking about the vaccinations. There's also this misunderstanding about the vaccine and what it does to protect people. People don't necessarily understand how vaccines work. And Hazel, I want to actually get to you on this. Can you discuss with folks that the potential for people to get reinfected if they get COVID? And also what it truly means to get vaccinated, because the understanding that most people have is that once they get vaccinated, they're all set. And in reality, you can still get COVID when you get the vaccination. The chances of you having an adverse reaction to getting COVID are greatly reduced once you're vaccinated. So can you talk a little bit about that?
Yeah. So when you get the vaccine, you get the first shot, and there's about like Raymond mentioned earlier, about 21 days, and then you get your second one. Now, within that time, you can be exposed to COVID, and yes, you can get sick. And then even after the second one, because it's not like you get the vaccine and immediately you're immune to it as soon as you walk out the door. It takes time for the immune response to build up. So it's not like, well, I got the vaccine, I'm gonna go hit the club or something, I can be around people too. That's not how it works. Also, so far, I guess now when people get vaccinated and it gets extended to past 90 days and so forth after getting vaccinated, we get to see like how long will this immunity last from the vaccine. Because from getting the immunity by actually getting the COVID is about 90 days. But for the vaccine, we have to wait basically to see how long it will last. And that will determine like how often does this vaccine have to be taken.
Because we're seeing now, you said if you catch COVID itself, there's about a 90-day period where your body will likely be immune to catching COVID again. But after that 90-day period is over, you can get COVID a second time. Yeah. Now, hopefully, your body has built up an immune response that can respond to COVID almost immediately and keep you from having adverse reactions to it or severe hospitalizations and things like that. But you don't want to be catching COVID every 90 days. If you can help it.
And that's where the vaccine comes in. It's like you get the immunity we have without having to go through the experience of all the symptoms and having actually the illness. Maybe you will get like a chills or a headache or something, but it's something mild and it won't last weeks or have you ending intubated at the hospital or God knows, like using a ventilator or even that. Because then you will actually not get immunity to this.
Right. So if a person is, I guess, vaccinated and they have more of a tendency to have an asymptomatic case of COVID, should they contract it, how would that, I guess, have an effect on their ability to act as a carrier or spread or shed the virus while they're having this asymptomatic infection?
Well, that's actually like a problem, I guess. Like a lot of people, I know of people that know they even have it, but they're asymptomatic. It's like, I'm feeling great. And they just go to work or whatever, and they spread it to other people. But then these other people might actually get the symptoms or may have like underlying conditions or something that they will actually, the illness in them will be even worse. So it's like, yes, you are not showing symptoms, but you can still spread it around. It's like, well, good for you that your immune system is good enough to like keep it at bay, but not everybody will have a similar response. So it's still important to like follow the guidelines of mask, distance.
I have known people within families as well, unfortunately. Like I just had a family friend, their daughter pass away. They basically contracted it by attending a funeral, visited someone at a funeral, then they got it, they were being cared for by the younger children, then their younger children got it, and then one of them ended up being hospitalized and subsequently actually just passed away today. And it's just like, you don't know who you're going to impact with that decision, and it goes with the same thing, vaccinations. Like sometimes it could be something as simple as being in your same household. It could be something where your child gets sent to the same school as another child who gets exposed to it and then brings it back over to you. So that circle of life, a wind away, coronavirus fires this way and like will infect you because it's so insidious. You think all these precautions you take that you're protecting yourself, but it's like you can't see the viral particles, and even though you don't have any symptoms clinically, physically that you can convey to someone else, doesn't mean that there's not something more sinister fomenting with every breath that you take,
Because there seems to be several different, for lack of a better phrase, phenotypes for COVID infections, right? There are people who get COVID and no one would know at all. There are people who get COVID, get very, very sick and recover excellently. Mm-hmm. And then there are people who get COVID and recover, but have long-lasting effects because of COVID. And obviously, the last group is people who get COVID and die, right? And so do you want to take a chance of being the best of those four options? The chance, you're taking the chance of being the best, and at the same time, you're also taking the chance of being in the worst categories, right? Because even if you survive COVID, there's no guarantee that you're not going to have lifelong repercussions of being infected. And at this point in time, we don't know the extent to which COVID has these long-term effects on our bodies.
Mm-hmm.
That's right. There have been people who have had double lung transplants, obviously people who've passed away. I've gotten heated arguments with family members about this type of issue, and even with vaccines, not just for COVID, but for even the influenza vaccine. We take for granted how protected we are.
Mm.
You know, only about maybe 30,000 to 60,000 people die a year from the influenza virus, right? But we take for granted how many more it would be were it not for that vaccine. Many people cast aspersions. Oh, well, it's not even that effective. This shit's only like 44%. Like, I'm not gonna get my and some people even have the audacity and gall to me. Well, I don't get the flu. I'm like, just like with COVID, you can't tell. You could have just a mild headache one day, and that could be you with the flu.
Mm-hmm.
And you have the flu, you pass it on to your elders, to your children. And I've had situations, and when I was working in California, there was one particular community out there, I think it was Maricopa out there, where there was a large percentage of people that didn't vaccinate themselves. Like they just chose not vaccinate their children. And so they would go to school and get upset when they would be required to vaccinate their children. But then you would have one family who maybe was of that ilk, and then their child had unfortunately developed an oncologic disease, developed cancer, leukemia, right? And then they were vulnerable to every single viral infection you could imagine.
Yeah.
So even something simple like a vaccine, like an influenza vaccine, something simple, because they didn't get the vaccine and because the other children around them didn't get the vaccine, then they were vulnerable. And they would come into the hospital sick because they went to school and they were playing with other kids. And it's just like, there goes a hospitalization for your child, that didn't have to happen, or could have been potentially avoided as a result of that, and it's unfortunate that we take for granted how impactful vaccines have been on reducing like just death and destruction in our communities.
Mm-hmm.
Dr. Hudson, you've done a great job. If anybody's followed our chats since the beginning, I think you've done a phenomenal job at explaining the difference between influenza, AIDS, polio, and
Yeah.
COVID as far as the vaccines are concerned and how they're different. And we've had a discussion about how, with polio, for instance, for all intents and purposes, polio has been eradicated because there was such an amazing vaccination strategy by the country to get everybody vaccinated. And then there were several reasons why that was the case. Polio presents very physically, and the effects of polio were well known, and you can see it. Can you talk a little bit about the difference between AIDS and influenza and COVID, the way they mutate, and why we need to take COVID more seriously than we take something like the seasonal flu?
Yeah. So when viruses take over your cell machinery, right? Our cells are a little more sophisticated, right? Than a lowly virus that's just a protein bubble with a piece of DNA or RNA inside, right? So when our cells are copying their transcript, there's a lot of chance for error, and that's how mutations accumulate over time. The flu and HIV are a lot more volatile in that way than COVID. That's why we have sort of flu seasons with, a new strain every year that we have to develop vaccines for. And with HIV, that's why it's almost impossible to target because of how expertly it evades your immune system and hides in your cells, and how rapidly it mutates within each host. The COVID virus is a little more stable in that, it has like a little gene editor that helps correct mistakes, that prevents, it having a higher rate of mutation. And also it's just, we're seeing that it's a little, we know from our, you know, long history studying coronaviruses, that it's a little more stable in that way. So what I want to say about that is just that, you know, even though right now we're just right on the cusp of vaccines rolling out, you know, just started doing it across the country. And so it's really important that we all get one, not just for all of the reasons we just mentioned, but also because the sooner we all get vaccinated, the sooner we stop giving it hosts to mutate within. Because one of the things that we're seeing now are these little pockets of mutations here and there. We've got this UK variant, South African variant, and there's sure to be others. If y'all won't sit at the crib, and do what you're supposed to do, and you're not going to get vaccinated, there's sure to be others. Right now, they're saying that at least, you know, with the UK variant, it's just sort of changing, making it more infectious, but not necessarily more deadly yet. With the South African strain, it's a little more troubling because it's sort of, that mutant is changing the spike protein in a way that helps it evade antibodies, at least antibody drug treatment. I don't know if they've demonstrated it for natural antibodies yet, but that's troubling. Right now, they're saying those vaccines will still cover some of the mutations that have sprung up around the world, despite, you know, sort of that variation. It'll still have good coverage. But we need to be mindful of the fact that what we're doing every time we gather and not adhere to the recommendations and make sure that we are keeping each other safe is giving that virus a chance to learn, a chance to figure it out, you know what I mean? And mutate and become better and a more effective killer. That's what we're doing. We helping it, you know what I mean?
Mm-hmm.
Hazel, can you speak a little more to that as well? I'm under the belief that the reason why we have to get an influenza, different influenza vaccine every year, on top of its instability, is the fact that we have so many people who choose not to get vaccinated and offer themselves up as hosts for these mutated strains. You know, so if we had more people who weren't anti-vaxxers who got the flu vaccine, who then could not be hosts for the flu, then potentially we wouldn't have different strains of the flu every single year. Is that an accurate assessment?
Yeah. I mean, again, this kind of goes back to the herd immunity and also what Shanice mentioned. So viruses, unlike us, they are very good and quick about mutating, so they can switch quick. And basically, yeah, they learn. It's like, well, learn slowly, quick at being better and quicker and basically a better killer. And the fact that not everybody is taking the vaccine, that is not, it won't slow down the virus. Ergo, giving an opportunity for it to keep hopping around, keep learning and getting better at its job, basically. Now, if people will get the vaccinated, more people, then it gives less chance for this virus to keep hopping around and it won't get exposed to different things or whatever. So it won't learn, it won't, it basically slowed down its spread, and decreasing also mutations. So.
And so in terms of like, you know, we've talked a lot about some of the obstacles and the barriers, the challenges that we face in trying to get this messaging across in Black communities. But what do you guys see as some of the challenges to getting the word out in a lot of Latinx communities? Because it's like your communities are just as diverse as ours, like socioeconomically and in a myriad of ways culturally. So it's like, what are some of these obstacles to getting the word out that you guys are perceiving from your interactions with your families and communities and or just in general?
I think lack of trust and lack of information as well. It's a lot of it is historical. We think about oftentimes from the early 1900s, the Flexner Report, which led to the sort of removal or sort of dwindling down of medical schools that were offering and training Black and brown folks in the early 1900s, to the Rio Piedras experiments that were done with the birth control pills, to the sterilization programs that were enacted, which affected all of the Caribbean. Liken that to the, Marion Sims, John Marion Sims with the OBGYN conducting experiments on this, slaves to Tuskegee experiments. These are all common threads and stories throughout history that have impacted the sort of medical therapeutic alliance and relationship with medical institutions in general. You combine that, you compile that with issues that we face in terms of access to medical care, constantly being denied, being huddled into communities where the most effective and best resources are denied, declined, or limited for us. All these different factors, having our pain marginalized, not necessarily acknowledged or misrepresented, even when physicians presented with the exact same scenarios, scripts, backgrounds, facial expressions, and video cameras, having studies conducted where they still offer worse care to Black and brown folks, in those type of experiments. This is a common thread. And so I think from many different angles, medicine has a lot of work to do to reach out. And it's been worsened by social media, because of it's so easy when it takes one bad story or faux story. I don't even want to use the term fake news, a faux story to be created to make people, like 100 people, skeptical. One good story might only make 10 people engender them or bring them closer to a truth, whereas this one full story will push 100 people away. And that's a constant daily struggle. I see it. And again, arguments with relatives and loved ones, people that I hold dear to my heart, about the misinformation. Again, like, well, I'm just not gonna get this, man. I'm like, I get it.
All the time. Yeah.
I get it, But like, if I'm telling you it's okay, that has to be good enough.
Right. I
can't be the person getting over a decade of education and information in this particular area. You know what I mean? Like, it's like, I have a family member who builds, houses, and they offer me advice. It's like, yeah, but I'm gonna go read this website, and they got this website, dopepeoplewhobuildhouses.com, and I'm on their chat every day, and this is one guy, from I don't even know where, probably like a 12-year-old child, posting content on there. So he tells me I need to use this one particular nail gun, and that's the one. It's like, you know what I mean? Like, you have someone there in your own unit, your own family unit, who's giving you the jewels, and you decline and deny that. And so I think, again, I've had those issues within my own family, working against that, because again, historical issues, mistrust, lack of, again, even growing up, me accessing medical care, the things that I was denied, when I was going out there, or I could visually see, even for family members, visually see that they were being denied. I go into Lincoln Hospital, which at one time, or I don't want to say anymore, but at one time was viewed as like, you're going in there to die. Like, you don't want to go to Lincoln Hospital. That's where I was born at, in the South Bronx, and you go in there literally to die. That's what people thought in their heads. You go into some of the spaces, you see holes in the walls in the hospital, like they're just there, just holes. It's like, you want to say something smooth?
I have some research about Lincoln Hospital, but I'll keep those to myself.
Oh yeah, they're constantly remodeling, man. We're constantly working on bettering the services to
my brother-in-law used to work there, so I've heard some stories.
Yeah, and whatever stories there were, it's 100 times better than when I was a child there. I can tell you that for a fact.
Wow.
For a fact.
Wow. And Lincoln, and to your point, Lincoln Hospital is essentially right in the middle of the hood. Yep. So it's servicing Black and brown families, in New York City. So if you can't get quality care from one of the largest hospitals in New York City, where are you going to get it?
Yeah.
And the thing is, again, it's not because the people don't want to. They're just limited resources, and a lot of that is intentional. Right? And you look at, for example, Congress, when the COVID was underway and terrorizing the country from its onset, Congress intentionally did not act. Again, they portrayed it as a political issue. They portrayed it as just a blue state issue, when it doesn't even matter if the majority of people in a blue state or a state voted for Democrats. There's still Republicans who live in those states.
Yeah.
You'd be surprised. I have people in my family in the hood who are Republican. So they were denying services and care to people, and denying, because again, hospitals were hit hard, medical communities, every industry was hit hard. But we needed hospitals specifically because we needed to make sure they keep running to care for sick people. And they were intentionally not acting because they wanted to get back at Democrats. Like, who does that?
Hazel mentioned
We
this.
do. Yeah, I was going to ask Hazel because I'm like, can we talk about Puerto Rico for a minute? Like, the entire Trump administration has been a pure shit show for Puerto Rico. And so it's just like, I guess, you know, I want you to answer the question too, just from your perspective. What are some of those challenges in trying to like cover people who have been disregarded for so long?
Yeah, well, I will say back home, actually, they're doing, compared to here, I will say, is a more, you can say exaggerated, but I think good. Like the curfew, or like at some point they were even fining people, like you would get a fine if you didn't have your mask. The beach, like they'll be closed only for exercise activities. Some people still get around it. So, you know, things like that, more compared to here. Like I still see sometimes, like the other day I was in Audi and this person didn't have a mask. And I just kept looking around like, nobody's gonna do something about this? Like, what? They just like, and God forbid you tell them something, because then that end up being a video on Facebook. And yeah, so.
I have an interesting story to on that point. I was in a Bed Bath & Beyond one day, and there was this woman there who was walking around without a mask. And this was like in the heart of the beginning of the first wave, because I don't really believe that there's a second wave, but the beginning of the first wave.
We riding the first wave till the wheels fall off.
We are.
Period.
And there was a woman walking around without a mask. And I went up to her and said something to her, not about the mask, but about something else I think that I had seen. And after we both were leaving, she said, "Oh, when you came to me, I thought you were going to ask me about the mask, because everybody always stops and talks to me about the mask. And, you know, I always have to tell them I'm not going to wear a mask, blah, blah, blah." And I was like, she was like purposely flouting the mask mandate. Like she just didn't care at all. And she wanted people to approach her, ask her about the mask. That's what she was looking for. And it's just ridiculous. And I think to your point, Hazel, a lot of these third world countries, you know, these other entities are handling this a lot better, because they don't have people who live in that society who believe that whatever they want matters more than what the community needs as a whole.
Hey, that's a word.
And I like to add to like potential obstacles in the community, Black and Brown. So I think like I've listened to a couple of podcasts and stuff, but there's the fact of the economy, but more about like the jobs. Like many of these people, they might be the only source of income in their house. So they're like, you know, it's like, I'm feeling good. Like they just like will power through. Like there was this lady, she was actually a, can't remember the word right now, but anyway, she was leaving, she worked in a meat factory, and she was a mother of 3 children. And also she will send money to her family back in Europe. And she was like, when she heard like the first person tested positive in the plant, I mean, we're talking a place that is crowded. Sometimes in the lines, they work close to each other. So, you know, just one person, and that just like spreads like wildfire. She ended up getting it. But she was like, she said that one day she was just sobbing, because it's like, if she doesn't get to work, it's like how she would provide for her children and her family overseas. So that's one thing. And then a lot of these people, they work in jobs like that, like the meat plant or the type of jobs that nobody wants to do. But they're more exposed, like say, like cashiers at a grocery store, things like that. They're more exposed to people like constant, circling of people, people that don't wear a mask, for example, and don't follow the guidelines. But then again, that's their job. They really need the job. So they just have to deal with it. And like in the beginning, for example, they didn't have like the plastic covers to protect and things like that. So in the beginning, they were just like basically naked to the virus. So there's that. There's also the case of the immigrants that in their case, they will be afraid to go seek help or the hospital because of potential of being called off by ICE. So there's also that fact. So, and I think it was in New York that Mayor Cuomo, like he blocked that for ICE, so then immigrants could get help in the treatment they needed. I love that guy.
No, I love that, and it's messed up that he had to go to those lengths to push those mandates, because that's how much we've dehumanized people in this society. Is that, or that's even that is like, I mean, we've dehumanized people to the fact that like they don't even care if people are going to get vaccinated for the global pandemic. You know what I mean? Like we have to tell them, please stop hunting them for 2 seconds so we can shoot them in the arm. That's crazy to me. You know what I mean? And it's like, if we were purely going to think of people as just like things, or like not dehumanize them completely, we're talking about millions of disease vectors, if that's the case, that you just want to let out into society and not worry about whether or not they're vaccinated, just because like, you don't, it's almost just like it's almost just like we have dehumanized people to the point where we can't even make arguments that are centered around the value of people's lives.
Humanity.
You know? It's crazy.
Neecey, do you want to talk about the Governor Cuomo statement?
No, that's what she was referring to. Is that he had to put out a mandate saying we don't agree to the, whoever the Health and Human Services Department, because
a lot of the programs want to have as part of their vaccination program to collect personal information from individuals and have access to it. And the concern is that it could be distributed to various federal agencies, including ICE. So they wanted to, his statement was very clear that he wanted to preclude that and prevent that from happening, and not make that as a criteria to participate. Because once you start injecting things like that,
no pun intended.
Yeah. Well, you introduce into the conversation an air of distrust, right? Because like, you don't want people to have distrust or distaste for the vaccination program at a time point we're in the middle of a pandemic, and people have to choose between getting deported and getting protected from a deadly vaccine, from a virus. Like you shouldn't have to choose between those two things. And again, especially like Hazel was just alluding to, in some, many families, these individuals are highly vulnerable and are the only breadwinners for their household, so that if they do become ill, they may not engage the medical system first off to seek medical care until it becomes gravely ill. And as well as that, they may stay home in a more crowded home and infect all of the other people. And like, it's just super high risk in every regard.
Yeah.
And I'm glad, Hazel, you mentioned the meat packing industry, and juxtaposing that with undocumented immigrants taking care of their families, because as we've heard recently, the Nebraska governor, Republican governor Pete Ricketts, stated that undocumented workers who work for these meat packing companies will not be allowed to get vaccinated. And it's an insane thing for all of us, I believe, on this call, especially to point what Dr. Hudson was saying, the lack of humanity in that statement, because, and we have to kind of question whether or not this is purposeful, right? Are they
No,
not
we don't. It is. It is.
so that these people will not be able to protect their own families, will not be able to work, may end up leaving because they can't work here in the United States, or end up actually dying, and then they're not an issue for these folks who are anti-immigrants.
There's no question. There's no reason to question it. If we're talking about just letting people die off in some like ridiculous notion of natural herd immunity, we are definitely at the point where we do not value life enough. It is definitely deliberate. They definitely don't care if a certain percentage of the undesirables in society get culled. That would be like bonus for them. So let's be clear about our messaging.
Yeah, and
it ain't a question.
It's already documented.
I think Ray, you pointed
to.
Go ahead, Dolio.
I was saying it's already documented that they wanted to spread it intentionally.
Yeah, and again, to Ray's point and Hazel's point, there's multi-levels that this affects. It's not just this person catching COVID, but this person catching COVID, not being able to work, not being able to support their families, coming home to a multi-generational household, which Hazel mentioned earlier, and Dr. Morales also talked about as well, and potentially infecting the grandmother who lives there, the grandchildren who live there, these grandchildren who may be American citizens, go to school with everybody else's children, could potentially infect those children. I mean, there's so many layers to this political decision not to vaccinate these human beings. Again, to Ray's point, when this should be just a health issue. The fewer people we have in this country who are walking around as potential COVID spreaders, the better it is for the entire country. Doesn't matter if you're Black, white, Asian, brown, purple, Jew, Muslim, Christian, undocumented, or American citizen. We need fewer people who are walking around as potential hosts for this deadly disease. And the fact that Governor Cuomo had to come out with a statement saying that ICE won't play a part in this process is ridiculous, because it should never be a question that ICE would play a part in the process of ensuring the safety of every American and resident of this country.
Well, I think the worst part about it all is that you probably all hit that point last year. Maybe it was in March, maybe it was in May, maybe it was in August, where you were rushing to the supermarket to get toilet paper, to get some milk or some meat. And you have to understand that during that crisis, it was the immigrant community that was leaned upon to keep the machine going. Right? They were the ones who were, working the hours in the fields and the factories, amongst our other American workers, trying to keep, again, the system going, because we wanted more meat. We wanted to have enough food and whatever, first world privileges that we have here, and not have them short. You want to be able to go to your Whole Food store and make sure that all your fluffy organic products were all ready to go and not well stocked in the aisles. They were behind that all along the way. These were essential workers that we leaned upon, that we're now asking, who also suffered at a high rate in terms of infectivity, the cases, deaths, etc., who are now leaning upon, or we're leaning upon and continue to lean upon, and now we're just leaving to saying you're not deserving of being vaccinated for these undocumented citizens in our country. It's like, what does that say about us as a people?
And
Dr. know exactly what it says about us as a people.
Dr. Hudson, you mentioned this several times about the core principle of hood medicine, and that's that people are selfish, and so we have to protect ourselves, right? So even if you look at this whole meatpacking industry situation in Nebraska in a selfish way, if those undocumented workers catch COVID and get sick, who's working in those meat factories? Who's producing that food? How are you getting meat on your table? And if you do, can you afford the price of that meat now that there's a high demand for workers and a low supply? So even if we look at this in a selfish way, it just doesn't make sense to not want to vaccinate as many people as possible, regardless of their status.
It does if you don't care if they perish.
Or not, yeah.
Yeah, you view them as a commodity, basically. You're
Yeah.
like a supply that you can basically replenish at your own sort of fleeting fancy.
We're in a place in society and civilization in our evolution where we, have evolved this system of commerce and everything, and we've commodified labor, but we haven't modernized any of that. So people alive today, because of the way that we continue to allow a certain race, a certain class of people, okay, to believe that they own the world, that they can do anything they want, okay? We see the ramifications of that. But to me, it's just another holdover from slavery, another holdover from medieval times, even, like, that we still have this notion that we should have a whole class of like serfs who have no rights and don't get to eat food and have roofs over their head. Like, we have never modernized labor in a way where we fundamentally believe that people deserve to exist outside of what they can do for our economy. You feel me? So it's like, to me, like, this pandemic has done nothing but reveal who we are. I don't want to say, I don't keep saying we, I mean, we collectively as humanity. Really, I mean y'all, and you know who I'm talking about when I say y'all, because it ain't us. Unfortunately, we didn't get to make society the way that it was. We're just living in it, dealing with it. And one of the things that we're most concerned with Hood Medicine is making sure that we all understand, if nobody else understands, if no one else can cut through the noise, that we understand that we are all we got. No help is coming. They argued a whole year about whether or not they was gonna give us $600. If we don't figure out a way to help each other, we're not gonna make it, And so I guess what we really wanted was to understand, to help, for all of us to start to understand what that really means. Like, what are the actions on our parts, the 5 of us and everyone else who's listening, all the ripples. What do we need to do to make sure our community gets vaccinated? Because trust me, Raymond, I feel you on the arguing. I argue bitterly with so many people, and all I've had to do is I can show you better than I can tell you. I'm gonna stay right here in this house, no matter how many times you keep inviting me to come over and do whatever, and I could show you better than I could tell you. I'm constantly arguing with my family about everything. They're always trying to guilt me into doing this or letting the kids come over. And it's just like, do you want my children to die? Like, it's hard to know, like, what the best way is to get through to people, especially like for me, and I guess for you too. It's so hard to even get through to the people who love you, who you love, who know that you know better than they do. Like, it's so hard to even get through to those people. And so I guess what we're trying to build in terms of coalition and just action is figuring out, what is it that we need to do? Like, I've read a lot from all these public health agencies about how we need targeted messaging in these communities. We all know that we're dying, right? We all know that we should be prioritizing vaccinations. It's in all the data, it's in all the reports. Look on the CDC website. Every report says the same thing, right? But I don't see a lot of people doing anything about it. And that's part of how we came to be, because we was like, we don't see nobody telling people in the hood what to do. And so we was like, if ain't nobody gonna do it, we gonna have to do it. And so I guess I just, if there's anything else you want to speak on in terms of like how we can reach these communities and help the understanding, in terms of, does it mean that we need to have like a Spanish language panel and like try to, target different, pockets in different cities in different ways, rural versus urban, that kind of thing. I mean, like, what are your guys' thoughts on that?
Well, I think for me, oh geez, I've gone again back and forth with family members, like I said, and I don't want to say I'm over it, but what I will say is I've focused my energy. There's always going to be the family members who are receptive or even just willing to be receptive. And they don't have to necessarily be willing to be receptive. There's a faction that is not. They're just set in their ways. And, you know, I don't want to, I tell them, shut up, just change the topic. We're going to agree to disagree. And I said, like, oh, you're not giving me a space. Like, no. This is not an argument. You don't argue with the teacher. You know, you're wrong and the conversation is over, and that's the end of the conversation. You want to have that position, that's okay, but you are not on the same level. Like, this isn't a feeling thing. This is not how you feel. This makes you feel like this is a factual scientific thing that's out of that realm.
Yeah.
Okay. But then I've told myself, I get out of that realm of arguing with them, because my focus is on the people who are receptive, and also the younger generation. Because if the younger generation looks to us and says, and sees what's going on, then they see us like, okay, I see this person that I respect hold this position. I see this person that I respect hold this position. And they have to mitigate and have to sort of navigate that world, right? Because as a developing individual, like, who's right? You know, I love both of these people, and I hold both of their opinions in high regard, you know, and I'm not their parent per se. And they may say, okay, well, I live with this person, so I need to hold them. That's why I say I don't even engage them and argue with them. I reach out to them and directly and through example and through communication and say, this is the right thing to do, period. I don't try to say this person is an idiot, this person is wrong, which they are, you know, their actions, but because that is a waste of energy, and it doesn't make them, that other party, feel good about that. You know what I mean? Like, you don't want to try to destroy the relationship that they have with those people to beat them down, but to say, when it comes to this topic and this type of information, they're not a good source. I don't try to use that language directly. I want you to say, they see me when I talk about, you know, information, like I talk about it in a set fashion. There's no language that this other party is going to use in the family that's going to give them like that strength, you know, that wisdom and knowledge that brings, you know, that bridge that I helped them to build to that fact. You know, that it's so sturdy that no matter what sort of hammer or sort of, or you know, construction work they try to do, wrecking ball, try to, like, this is built on fact. You know, this is a reliable connection I just made for you. You know, so I don't. And again, I still love those people to death. You know, but I said this pandemic has done a lot for me in terms of people, like, realize the relationships that I have and the people that I communicate with. What I value most, I've kept close. You know, and that's what that pandemic has done for me. And I said, I don't want to be arguing with people. So if I told you what it is, that's where we leave it at. If you want to say you're wrong and you want to come back into that conversation and be receptive, I'm here to be willing. But this is a class. You know, you can engage the professor, but at the end of the day, when you're in class, you were there to learn. You know, and that's just how it is. And it rubs some people the wrong way, and I'm okay with that, because it's got to be like that. It's got to rub you the wrong way if it was like if you're on the opposite side of that, because you're a student in the game, and I'm giving you jewels. And if you don't want to put money in your pocket, you're gonna feel broke, and being broke is never a good feeling.
What do you think, Hazel? That was amazing. That was a word.
That's true. Like, at least of my close family, they're pretty receptive. Mainly, I mean, I had to, with the vaccine, there were like questions and stuff, and I explained it to them. But so far, I haven't been exposed to my other family members that I think they will not be very receptive, especially even when they are like in risk groups. But I can give an example of a friend. She's a scientist too. She had to, like, her family was like, no, like, you know, it was a political, like, COVID is a hoax, blah, blah, blah. Then an asymptomatic person went to the job of the dad, gave him COVID, and then he gave it to his wife. And then his wife, he got a more mild experience with COVID, but she still had inflammation in her lungs months after. So, and it's like, oh, and then now it was like, nobody will come to my house unless you have a negative COVID test. It's like, all of a sudden, it's like, we believe now. Well, at least, because there's people that die and still, they're like, no, COVID is not real. So I know there is. Thankfully, I haven't been exposed to those families, but yeah, it's ridiculous.
As we wrap up, in your communities, what do you think is the most important entity in which folks like us can interface and engage with to have the maximum impact on those who are reasonably struggling with the decision of getting the vaccination or not? Is it churches? Are there community organizations that we should engage with? Where do you think is the best place to put that effort?
I definitely think churches and community centers are like a hotbed and an opportunity as well to engage. Many of them would love to be. I mean, churches historically have played a huge role within our communities, not only to mobilize but to galvanize people for political action, but also for social change and for for public health policies. Being centers for free clinics, being resources for education about different job opportunities and community programs, et cetera. Along with the community centers, I said churches and community centers are huge pillars in our communities that already have established networks. And it'd be foolish for us not to tap into them and rely on them and form partnerships with them to help mobilize people to get vaccinated. Even something as simple as getting people, shuttling them like as they do to church. Right. I'm sure you all have the church buses that, come on Sunday, pick you up at a certain time, and you have to wait for your turn, they call you and you get your turn. But using them as a mechanism to bring people to the vaccination centers, making sure, of course, people that are separated, good ventilation, people masking up along the way and doing those things. But those could be mechanisms they can utilize to participate in those programs. I've thought about this because, CVS's, Walgreens, et cetera, locally in the community are going to definitely have to be actively involved. I'm disappointed that, from a small business perspective, I would love to see the government reach out to a lot of the small businesses, Black and brown businesses that are right in the middle of the communities. For example, they have large freezers that aren't really in use, that are not really open, that they use them as a center to set up, right? To register and vaccinate people. Right? It would be lovely to see them do that. Now, I know they're probably going to, again, rely on the CVS's, Walgreens, but not every community has one of those, But we all have, a certain restaurant, or like, again, churches, or certain community centers that are within our communities that have established networks and relationships that, if they foster, could lead to faster vaccination.
That's a great point.
Oh, sorry. And I think also, like, providing the information of the vaccine, or when the vaccine is distributed in their language, helps a lot, especially when they're immigrants and not necessarily, they'll be all confused and it's like, what is happening, type of stuff. So I think it just makes them more perceptive to it. So.
And then I guess in closing, I wondered if we could ask each of you to sort of give your final thoughts on like what your message is to your communities about the vaccine. So Hazel, if you want to just
well, in general, it's like you should not be afraid. Like, for example, my brother, he brought up this question, like, how did they get this vaccine so quick? Like, all of a sudden, it's like, boom, mRNA vaccine, like, what is that? And I told him, this is stuff, there's no reason to be afraid. It's not like they just like snapped their fingers and came up with this idea. The mRNA vaccines is a technology that has been developing for years. And actually, like, you have, there's other ones too, mRNA vaccines like Zika, rabies, CMV, and so forth. It's just, and it'll be something that in the future, it will maybe slowly switch to that, because you don't need to use the, instead of being injected with the dead organism, the heat inactivated, or portions of it to induce an immune response, you can do it by just giving the instructions to the cell. So it's not something that happened overnight. It's just a technology that was available. And it's that also the other thing is like, it's very readily, that can be done with like things that usually are like, let's say in a molecular lab. So the ease of it also had to do. So that's why it seemed like it was fast, but this technology has been around for a while. It's just that it's not over, spread out use. So that if you have not got reactions before to vaccines, and you can take it so you can protect your family and other people that you are around. And so we can, hopefully reach this herd immunity soon, and, everything go back to normal.
Raymond.
A couple of things. Obviously, I always want to encourage people to get vaccinated. Vacunarse, everyone out there, it's really important to make sure you get that for all the eligible vaccines that you're available for. Get free medicine. Why not get free medicine? It just makes no sense not to do that. You protect our communities, and that's really about protecting our communities. That is the one thing that you can do, which requires little to no effort to do. I will also say, to provide way of information, there's a couple of people who should not get the vaccine. One, anyone who's ever had an allergic reaction to a vaccine in the past, specifically to the mRNA vaccine, should not get the vaccine. Two, people who have allergies to polysorbate. And the reason I say that is because the component that we think people are having an allergic reaction to when they do have one is that of polyethylene glycol, basically just a molecule that happens to be like almost like a preservative almost. It's in the vaccine mixture. It's like to help stabilize it. That's in there that, we think the bodies have a reaction to. And polysorbate is sort of similar to polyethylene glycol, which is in the vaccine, both mRNA vaccines. And so that's why we say if you have an allergy to polysorbate, you should not be getting the vaccine. And people who are, and those are the two main groups. People who are moderately or severely ill at the time should do so only under the direction of their physician. Right? That's a conversation between you and your doctor, because if you're really, really, really sick right now, your immune system is fighting something, you should not be adding another challenge for your immune system to have to fight, to be building up protection against the COVID vaccine during that period of time. There's not really any sort of precautions or sort of prohibited from women who are pregnant. People who are immunocompromised, right, as of right now, there's no real data suggest that they're not eligible. Again, unless you're moderately to severely ill, you should nothing precluding you from getting the vaccine unless you've had an allergic reaction, severe allergic reaction to the mRNA vaccine in the past, or the first COVID vaccine shot, or you have an allergy to the polysorbate or the polyethylene glycol. Those are the main groups. I know people wish I would bring this up, but I got seasonal allergies, I got this and I got that. Like, again, the main groups who should not get vaccinated: allergy to the COVID vaccine in the past, or people who have allergy to a component that we suspected is in the vaccine or similar to the vaccine, which is polysorbate. Or if you're just really, really, really sick, probably talk to your doctor about that before you do that. People who are immunocompromised, people who have severe allergies, let's say strawberries, latex, you're probably fine to get it, but if you want to talk to your physician or speak with an allergist before you do that, that's also reasonable to do. I think those are the main things I wanted to tell people. It's always easy to say, I'm just going to hold off and wait. But all you're doing is prolonging our ability to get back to a sense of normalcy. If you're eligible to get it now, the more you do that, the more you're delaying it. I'm just like everybody else. I just want to be able to go to a basketball game, man. I'm just trying to be up in the basketball game. That's all I want to do, man. That's my life right there. That's it. I just want to be able to go to the game.
Thank you so much. Yeah, we're so honored to have both of you guys on here. It's so short notice, may I also add. We really appreciate it. We are going to be doing everything that we can to continue sort of getting the word out. But I think you're right, it is important to maybe do some of these in Spanish. And so that's sort of our next goal, because I think the sooner we start getting messaging out, the better. So we're really honored to have both of you here tonight to share your expertise, to share your stories, and to, you know, sort of give all of the brown folks watching an example of a doctor who cares and a brilliant scientist who, you know, are hoping that you will trust what they're telling you and take it seriously and do your part to save yourself and save your families.
Thank you for having me on.
Yeah. So.
Yeah, thank you.
All right, everyone. Thank you for tuning in, and have a great day. Stay safe.